I make these videos for different people, and this one about the Thai healthcare system is really aimed at those people who are thinking about making a permanent move to Thailand. It's no secret that a lot of Western countries have big problems now. The UK, where I come from, is a classic example. The country is just falling apart. I won't get into the reasons why, it's not really relevant and it's very political. But a lot of people have already left and a lot more are thinking about leaving. The media has picked up on this trend and I'm seeing a lot of articles that suggest places people can go to. And typically it's a list of 10 countries and invariably Thailand is included on that list. And there's some basic information. What strikes me about these articles is that the people writing them have probably never lived in those countries. They've probably never even been to those countries. The information they're using probably comes from other articles and just from hearsay, and there's no personal experience. And the last one I read actually made me quite annoyed, and that was the prompt for doing this video. When it came to talking about Thailand, it said that the healthcare system is first class, which it is, and a visit to the doctor costs between 10 and 30 US dollars, which is about 300 to 1,000 Thai baht, which is complete nonsense. And in these articles, there's a lot of misinformation and basically fairy tales. So I thought I'd make a video and try to give people the reality of the Thai healthcare system. So what are my credentials for doing this? I came to Thailand for the first time as a tourist in 1987 and I've been living permanently in Thailand since 2003. I've had medical problems myself and I have two kids who were born here, both born with quite severe medical problems. So I've dealt with Thai doctors and Thai hospitals far more than I would have liked, ideally, mainly because of the kids. So I do actually have quite a lot of experience of living in Thailand and dealing with the Thai healthcare system. I'm not doing this from a script. And I'm not particularly good at just speaking freely. I just have a lot of experience and knowledge up here and I'll try and get that out on the video. When I first came to Thailand, I didn't know anything about the healthcare system. And it's very different to the UK system that I was used to. In the UK, everyone has a GP, a general practitioner. So if you have a medical problem, you go and see your GP. The GP will try to diagnose a problem and prescribe medicine. If the GP can't fix it, then they will refer you to a specialist doctor or a hospital. In Thailand, that just doesn't exist. So if you have some kind of a medical problem, what do you do? Who do you go to see first? The first thing you can do if you don't feel well is go to a pharmacy. There are lots of pharmacies in Thailand. Outside there'll be a sign that says either Ran Ya, which is a medicine shop, or Kai Ya, sell medicine. Even if you can't read Thai, it should be quite obvious that it's a pharmacy. The pharmacists in Thailand do a 6-year degree, the same as doctors. They're not allowed to touch you or examine you the way a doctor would. So it's just a verbal description of the problem. Most can speak English, and if you're in a tourist resort or if you're in Bangkok, the pharmacist will probably speak a lot of English. And then based on the verbal description of the problem, they can probably prescribe some kind of medicine. And in Thailand, they sell antibiotics over the counter. So even if it's an infection that requires antibiotics, they can still give you antibiotics without a doctor's prescription. And they're pretty good. So if it's not too much of a serious problem, just pop into a pharmacy and the pharmacist should be able to help you out. The second option is a private clinic, and where I live there are lots of private clinics. Doctors in Thailand generally don't earn very big salaries. My son was born with pneumonia and spent 3 weeks in a neonatal ICU unit. And the doctor who treated him had studied for 6 years, then had about 12 years experience, so he's an experienced doctor. His salary at the public hospital was 27,000 baht a month. And a kid coming from abroad to teach English with like zero experience will earn more than that. The doctors like the full-time jobs at the public hospitals because they're government jobs, and when they retire there'll be a pension. But because the salaries are so low, they need to supplement their incomes. So many will work part-time at a private hospital, and some will open their own clinics. So the clinics are a good option. And if you see a doctor at a private hospital, it will be quite expensive. But if you find out that he's got his own private clinic, you can see the same guy for a lot cheaper. With the private clinics, it's normally like a specialised field of medicine, not general. So, you know, one clinic might be for eyes, one for ears, one for skin. So you need to know which one to go to. All the information outside will be written in Thai. So unless you can read Thai, you're going to need some assistance from a Thai person. But certainly the private clinics are one very good option to see a doctor, get good treatment at a reasonable price. The next option is a private hospital, and as a foreigner in Thailand, this is where you are expected to go for your healthcare. There are other options, but they're really only for the Thais. You know, if you're a Farang, you go to a private hospital, and these places are fine. You walk in, and the best places are like 5-star hotels, and because this is where foreigners are expected to go. When you walk in, there'll be meet and greet staff who speak English, and they will run over to you and, you know, ask you what the problem is, and they'll take you to the doctor, and if you need an x-ray, they'll take you to the x-ray department, and then they'll take you to the pharmacy to get your medicine, and finally they'll take you to the cashier to pay. So it's all quite impressive. These places aren't exactly cheap, and this article I saw that said, you know, a doctor's visit will be between 10 and 30 US dollars is complete nonsense. At the end of last year, my lad got quite sick, and it turns out that his pancreas has suddenly stopped producing insulin, so his blood sugar level had gone through the roof. He's got type 1 diabetes. I took him to a private hospital at first. He was only in there for a few hours. When they'd done the diagnosis and realised what the problem was, they decided they couldn't give him the 24-hour observation that he needed, so sent him to a public hospital. So we were there just a few hours, and that was 14,000 baht. And then I got a bronchitis, and I went to a public hospital. My first visit was 12,000 baht, and then the follow-up was 3,000 baht. These places aren't cheap, and the public hospitals are there to provide healthcare. The private hospitals, their primary function is they're a business, and they need to make money. You know, that they do provide healthcare, but that's really like a secondary consideration. They're a for-profit business, so they charge high rates to see a doctor. The medicine's more expensive, and these places will have lots of private rooms, and what they want to do is to keep those rooms occupied all the time, and that there's nurses there. They want to keep the nurses busy. When I was in the UK, if I went to a hospital and they'd really try to avoid admitting me because there are no beds. In these private hospitals in Thailand, they want to keep all the beds full all the time. So I've been to private hospitals before where I haven't been that bad, but they've really tried to encourage me to be admitted because they're going to make more money that way. So it's all very impressive, and the care is good, but it's not cheap. And my wife's friend husband, he works for one of the oil companies in St. Clair, and they give him health insurance. And a few years ago, he got really sick with something and had to go into ICU in one of the private hospitals. It's actually the top private hospital here. And apparently that costs 60,000 baht a day. So if you have a really big problem and need to be admitted to ICU and you don't have insurance, then expect a very big bill. Just to give you an idea about the difference in cost between a public and private hospital in Thailand, when my daughter was younger, she had a problem with her feet, and I was taking her quite regularly to see a doctor in Bangkok. And we'd normally see him at the Rama Tipodi Hospital, which is a public hospital. And the doctor's fee alone was 50 baht, although later on it was increased to 100 baht. And when we got the next appointment, I would book our flights and hotel in advance. And on one occasion, the hospital got in touch with me and told me that the appointment had been cancelled. Thailand had a new queen, and it turns out her birthday was on the same day as the appointment, and that was now a public holiday, so they cancelled the appointment. So my flights and hotel were non-refundable, so I called the doctor to see what I could do, and he agreed to see me the day before, but he was working at a different hospital. He was working at the Bamrungrad Hospital, which is probably the top private hospital in Thailand. So I saw him there instead. But when I got the bill, the fee for seeing the doctor was 1,430 compared to 50 baht at the public hospital. So the private hospitals are very nice, very impressive, but they're quite expensive. Finally, there are the Thai public hospitals, and because of my personal situation and the problems with my kids, I'm full of admiration for Thai public hospitals. When my daughter was born with a problem with her feet, we went to a public hospital locally and then to one in Bangkok, and she saw the best doctor in the region for her particular problem. That was all very, very cheap. When my son was born with pneumonia, he went to a public hospital and stayed in the NICU unit for 3 weeks. They took great care of him. That was all free. All the follow-up visits were free. When he was diagnosed with type 1 diabetes last year, he went back to the same hospital. Again, it was all free. The only thing I paid for was that once he was past the 24-hour observation stage, I paid for a private room because my wife was staying with him overnight, and that was more comfortable for her. But everything else was free, and the follow-up visits are free, and all his insulin supplies are free, and the equipment he needs, the instrument to check his blood sugar level and to inject the insulin, everything free. So I have lots and lots of praise for the public hospitals in Thailand, provided you're Thai. If you're a foreigner, the public hospitals will look quite a bit different. These places are where poor Thais go for their healthcare, and there are a lot of them. Whenever you go to a public hospital, there are crowds of people. It's quite chaotic. Everyone's speaking Thai, all the signs are written in Thai. If you don't speak or read Thai, you're going to be quite confused. The private hospitals want foreign patients, so they employ staff just to help the foreigners. no such staff exist in public hospitals. You're totally on your own. But there's nothing to stop you using these places. And if you don't have the language skills, maybe a Thai friend could help you. But if you do go to a public hospital, expect long wait times purely because of the sheer volume of people there. Regarding costs at the public hospitals, I'm really not sure. I've never actually been for treatment myself at a public hospital. I've only taken my kids there, and because they're Thai citizens, they have gold cards, which entitles them to free or very cheap treatment. And that's the same for all Thais that use the public hospitals. They've paid into the system, so they get the free or cheap treatment. Foreigners who haven't paid into the system need to pay, but I'm not sure how much. Presumably cheaper than the private hospitals, but how much cheaper, I really don't know. In general, Thai public hospitals aren't really intended for foreigners, but there are some exceptions. One of the public hospitals here opened a premium clinic. The idea being that they would offer a service more akin to a private hospital, but based in a public hospital. And it's a bit cheaper than going to a private hospital, and the premium clinic is very welcoming to foreign patients. I'm very positive about the Thai healthcare system, but occasionally things do go wrong. There have been a few high-profile stories of people going in for surgery and not coming back again. The cosmetic surgery industry is very lucrative, and there have been a few cases of Thai doctors doing cosmetic surgery without actually being trained to do that type of surgery. So if you're thinking of having something like that done, do your research, make sure the doctor is fully trained, and read some reviews. Also, misdiagnoses. Several years ago, I lost hearing in one ear and went to see a doctor who told me that I had a perforated eardrum. The problem was just some loose wax that got wedged in there. And 2 days before my son was diagnosed with type 1 diabetes last year, he went to see another doctor who told my wife he's fine, no problem at all. So there can be problems, but generally I'm very positive about the healthcare system here. To summarise, yes, Thailand has some very good doctors and hospitals. It also has some very good dentists. When I was in the UK, I paid a lot of money at a private dental practice for the top man to do my teeth. When I got to Thailand, I still had lots of problems with pain and sensitivity. I've had a lot of work done in Thailand, and now my teeth are great, and I had a dental implant earlier this year. If you understand the system and you know what options are available, and preferably have some Thai language skills, you can get very good healthcare at a reasonable price. If you don't have a clue about any of that, and you just head off to the local private hospital when you have a problem because there's a nice girl there who always helps you and she speaks English, that has the potential to get very expensive. Age, of course, is another factor. If you're young, even into your 50s, you shouldn't have too many problems with your health. I will be 65 later this year, and when I was approaching 60, several people told me that after 60 your health really starts to go downhill, and that's correct. I have a problem that many older men suffer from, and it will need surgery sooner or later. So if you're coming to Thailand at a young age, don't be too concerned. If you're older, then you need to look at the health options more carefully. So what about health insurance? And I used to have inpatient and outpatient insurance. I stopped getting the outpatient insurance because it just wasn't worth it. It cost me around 10,000 baht a year, and I could only claim up to 1,000 baht each visit. So I would have to make 10 visits to outpatients in a year to get my money back, and that just doesn't happen. Most years I never go to outpatients. Some years I might go once or twice, but I still have inpatient insurance for me and my family. And what I pay is quite reasonable, but I've been with the same insurance company for over 20 years. And like, they know that I'm a low risk, so I've made very few claims. A few years ago, the premium jumped up quite a bit in consecutive years. I thought, well, what's going on here? So I contacted some other health insurance companies to get quotes. And I was quite shocked at how much they wanted. I know that the term shocked on YouTube is vastly overused, but I really was shocked because with these other companies, I would be a new customer and that they didn't know what sort of risk I posed to them. So if you're a new customer with an insurance company, expect to pay a lot of money at first. It will go down eventually, but initially it's going to be a lot. Also, with health insurance companies, they won't accept new customers if they're above a certain age. So that's something else to be aware of. I hope that's given you a bit more of an idea about the Thai healthcare system and has been more useful than just telling you that Thailand has a first-class healthcare system and each visit to a doctor will cost you 10 to 30 US dollars, which it won't. Thanks for watching.